You likely have been told that weaker legs are just a normal part of aging, but that's not the full story. The truth is many seniors deal with leg weakness because of a silent deficiency in 3 specific vitamins. The only problem is these nutrients are inexpensive to produce, which means there's no money in mass producing or marketing them. And because of that, many doctors don't know much about them, let alone how to use them effectively. Even worse, when it comes to treating the symptoms rather than the root causes, there's big money to be made. That's why it's so important to get the facts from an independent source. So keep watching to learn about the 3 vitamins that can strengthen your legs, reduce pain, and help you walk with confidence again. Just a quick reminder, we're not doctors. This video is for educational purposes only. If you have a medical condition, please talk to your doctor before taking any new supplements. The 3 vitamins to strengthen your legs. Let's start with No3, which if you're already taking, you might not notice any difference unless you take it at the right time. And what you're about to learn will explain why. As we age, our ability to absorb nutrients naturally begins to decline. And unfortunately, this includes vitamin B12. Once you reach 60, your stomach produces less and less of a protein called intrinsic factor, which helps you absorb B12 from food. And this doesn't mean you're automatically deficient, but it does mean you need to find other ways to get more of this essential nutrient into your body. Without enough B12, your red blood cells don't work as well as they should, which makes you feel tired, weak, and out of breath. It can also lead to problems like numbness, tingling, and burning in your feet, which is called peripheral neuropathy. What's worse, having low levels of B12 can increase your risk of falling by 42%. That's because it affects your brain's ability to communicate with your nerves and muscles, which leads to poor coordination and balance. So what can you do about it? Well, luckily B12 is available in pill form and you don't need to take much. Just 2.4 micrograms per day is enough to meet all of your daily needs. But here's the important part, when to take it. As mentioned earlier, there's a link between vitamin B12 and your nervous system. Studies show that taking B12 at night increases the amount of time it stays in your system by 47%, allowing it to travel to your brain and nerves more efficiently. To make things easier for yourself, consider buying sublingual tablets, which dissolve under your tongue instead of going through your digestive system, delivering B12 directly into your bloodstream. But that's not all. There are different types of B12 supplements, and some work better than others. Look for a supplement that contains methylcobalamin, which is the most bioavailable and easily absorbed form of B12. And remember, more is not always better. Too much B12 can interfere with other nutrients and even cause neurological problems. This brings us to the second part of the trifecta, vitamin D3. Did you know that over 70% of seniors don't get enough? This puts them at risk of losing muscle strength, slowing their reflexes, and increasing the chances of falling. In fact, according to the National Institute on Aging, a person's risk of falling doubles with each 10 microgram per ml decrease in vitamin D blood levels. But it's not just about preventing falls. Vitamin D3 is essential for keeping your immune system strong, warding off depression, and improving sleep quality. As you age, your skin becomes less efficient at absorbing D3 from sunlight. And although it's found in some foods, like fatty fish and fortified dairy products, it can be difficult to get enough through your diet alone. Luckily, there are plenty of supplements to choose from. And of all the forms of vitamin D, D3 is the best option for seniors. Taking D3 regularly strengthens your bones, improves your mood, and helps you absorb calcium and phosphorus, which are important for overall muscle function. However, the question remains, when is the best time to take it? Studies show that taking vitamin D3 at night has several advantages. First, your body produces more melatonin, a hormone that aids in sleep and helps you relax. This allows the D3 to be absorbed more easily and quickly, making it effective sooner. Second, D3 promotes deeper sleep, which is essential for healing and repair. Finally, during sleep, your body releases growth hormone, which works with D3 to improve muscle protein synthesis, leading to stronger legs. So the takeaway here is simple. Try to get at least 1,000 to 3,000 international units of vitamin D3 each night before bed. And don't worry, too much D3 is hard to come by. The recommended upper limit is 10,000 IU. But as always, if you have any concerns, talk to your healthcare provider first. And that leads us to the final part of this trio, vitamin K2. Chances are you haven't heard much about K2, but it could be the most important of the three. Unlike its cousin vitamin K1, which helps with blood clotting, K2 has the ability to move calcium around your body where it belongs. Without enough K2, calcium can build up in the wrong places, like your arteries, joints, and soft tissues, leading to stiffness, cramps, and even vascular damage. On the other hand, K2 helps direct calcium to your bones and teeth, keeping them strong and healthy. But that's not all. K2 also activates genes responsible for muscle regeneration and boosts collagen production, which is important for maintaining strong, flexible connective tissues in your legs. According to research, taking K2 along with D3 can improve muscle strength and balance. And that's because vitamin K2 activates osteocalcin, a protein that plays a key role in bone metabolism and muscle function. A study published in the journal Nutrients found that seniors who took K2 experienced a significant improvement in lower body strength and balance in just 8 weeks. In fact, the participants were able to complete more than 2 additional sit-to-stand exercises per minute, which may not sound like much, but in the world of fitness, that's a huge jump. So how does K2 work overnight? Well, as with D3, your body absorbs and uses K2 more efficiently when you take it at night, thanks to increased levels of melatonin and growth hormone. The best form of K2 to take is MK7, since it lasts longer in the body and provides a steady stream of nutrients throughout the night. Also, it's important to take K2 with D3 since they work together to keep your bones and muscles strong and healthy. Just be sure to read the label and follow the instructions. Some brands recommend taking 100 micrograms per day, while others suggest 200 micrograms. Remember, the combination of B12, D3, and K2 works synergistically, meaning they amplify each other's effects. Taking them together allows your body to absorb and use them more efficiently, enhancing their impact on leg strength, balance, and recovery. To put this all into practice, here's what you can do to get stronger legs and reduce pain. Take vitamin B12 sublingually 30 minutes before bed to help with balance, coordination, and nerve health. Take vitamin D3 and K2 together with a small snack, like almonds or a piece of cheese, 20 to 30 minutes before bed, to boost muscle strength, bone density, and reduce the risk of falls. Make sure to stay hydrated by drinking 1 glass of water every 90 minutes throughout the day. And avoid heavy or sugary meals close to bedtime to allow your body to focus on repairing muscles rather than digesting food. Sleep at least 7 to 8 hours a night to maximize muscle repair and nerve regeneration. We hope you enjoyed learning about these 3 vitamins and how they can improve leg strength. If you're interested in incorporating them into your nightly routine, try them for at least 2 weeks and pay attention to how you feel. If you notice any benefits, share your experience in the comments below. And as always, consult with your healthcare professional before starting any new supplements. Thank you for watching and see you in the next video.